Afternoon. Joining me are Secretary of the Maryland Department of Disabilities, Carol Beatty, Deputy Secretary for Public Health Services, Dr. Jinlene Chan from the Maryland Department of Health, the Executive Director of the Maryland Emergency Management Agency, Chaz Eby, and our Senior Medical Advisor on COVID-19, Dr. David Marcosi from the University of Maryland Medical System. Today, the state of Maryland entered Phase 2A of our COVID-19 vaccine plan, which means that all Marylanders age 60 and older are currently eligible to receive a COVID-19 vaccine. As of today, the state of Maryland has administered more than 2,250,000 COVID-19 vaccines. More than 70% of all Marylanders over 65 have received a vaccine, as have nearly 35% of all Marylanders over the age of 18. Maryland is vaccinating residents at a faster pace than 32 other states, and we're now averaging more than 43 shots per day. The Maryland Vaccine Equity Task Force has completed or is in the process of completing a total of 55 missions to date, and they've rolled out mobile clinics across the state to access hard-to-reach areas. They're holding more clinics nearly every single day, including today at the First Baptist Church of Glen Arden and the First Baptist Church of Highland Park, both in Prince George's County. We're seeing significant increases in the vaccination rate in the hard-hit zip codes where General Burkhead and her team are actively engaging with community partners and to do community clinics. Earlier today, I had another meeting with the White House Coronavirus Task Force to discuss vaccine supply. As you know, we have spent months building an infrastructure capable of doing 100,000 shots or more per day, and we are fully prepared for an increased supply from the federal government, which has committed to a significant increase in vaccine supply beginning next week and continuing each week for several months. As a result of the robust infrastructure that we have built, our rapidly accelerating vaccination rate, along with the supply increase that we've been waiting for and that we can now expect 1 week from today, Tuesday, March 30th, Maryland will move into Phase 2B, which includes all Marylanders 16 and older with any medical conditions that increase the risk of severe COVID-19 illness. Today, we are also announcing that Phase 2B will be expanded to now also include all Marylanders 16 years old and over with disabilities. People with disabilities experience significant barriers to accessing health services. So the Maryland Department of Disabilities, along with the Maryland Department of Health, are working together to try to close that gap and to make sure that no one is left behind. Effective today, we are also immediately launching pre-registration for all of those who are eligible under Phase 2B. More than 150,000 Marylanders have already successfully pre-registered on our new state website for an appointment at one of our mass vaccination sites. We encourage any Marylander over age 60 and all Marylanders age 16 and older with any medical conditions that increase your risk, or any Marylander 16 and over with a disability. All of them can pre-register effective right now by visiting covidvax.maryland.gov or by calling the state's COVID-19 Vaccination Support Center at 1-855-MD-GO-VAX. 1 week later, on Tuesday, April 13th, we will move into Phase 2C, which will include all Marylanders 55 and older, as well as all essential workers of any age in critical industries. The final phase starts Tuesday, April 27, when we will be fully open in Phase 3, and every single Marylander over the age of 16 will be eligible for vaccination. On Thursday, I will be visiting the state's newest mass vaccination site in Western Maryland, at the Hagerstown Premium Outlets. And I want to thank our Health Secretary, Dennis Schrader, Director Eby, and their teams, along with the Maryland National Guard and all of our other agencies in state government and all of our other partners for their incredible efforts to plan, design, build, and launch all of our mass vaccination sites. As a result of all of their efforts, I'm pleased to announce that we will launch 6 more mass vaccination sites in April. The week of April 5th, the Timonium Fairgrounds site, in partnership with Baltimore County, will transition into a state mass vaccination site. That same week, we will also open a new state mass vac site at Montgomery College in Germantown. The following week of April 12th, we will open mass vaccination sites in both Anne Arundel and Frederick County. We will also be opening mass vaccination sites in Howard County and in Harford County in the following weeks, giving us 12 state mass vaccination sites that are all fully operational in the month of April, all throughout the state. We also continue to have ongoing discussions with other counties and other partners regarding potential additional vaccination site locations. We currently have more than 2,500 points of distribution, and that will grow by hundreds more to over 3,000 different places to get a vaccine. We're going to be adding hundreds of doctors' offices and pharmacies, in addition to expanding the reach of our community clinics throughout because of the work of our Equity Task Force operation. I want to once again strongly encourage all Marylanders to please get vaccinated when it is your turn to do so. These COVID-19 vaccines are proven to be safe and effective, and they're administered under medical supervision. And getting vaccinated is absolutely vital to stopping the spread of COVID-19 and to returning to a normal life once again. More than 400,000 Marylanders have been infected by COVID-19. More than 36,000 of them have been hospitalized. And sadly, as of this morning, more than 8,000 Marylanders have died from the coronavirus. But each day truly is now bringing us one step closer to that light at the end of the tunnel. At this time, I'm going to turn it over to a great advocate for the disabled community, Secretary Carol Beatty of the Maryland Department of Disabilities, who's going to share more on our initiatives to vaccinate Marylanders with disabilities.
Thank you, Governor, and thank you for your leadership during the pandemic. Besides advising the Governor on disability-related issues, the Maryland Department of Disabilities works collaboratively with all state government agencies. Our department provides guidance and subject matter expertise to ensure that state entities deliver services in the most integrated settings possible and develop consistent policies affecting people with disabilities. Never have our responsibilities been more impactful than during this last year, and the rollout of vaccinations is no exception. Thank you, Governor Hogan, for recognizing the increased risk of people with intellectual and developmental disabilities, or IDD, and placing them in Phase 1B. With today's announcement, you have continued your commitment to ensure that the most vulnerable Marylanders have access to vaccine. This decision impacts and affects Marylanders 16 and older with disabilities who receive supplemental security income or Social Security disability insurance, and an array of long-term services and supports that are provided through the state's Medicaid waiver and state plan service. Research shows that non-elderly people with disabilities who receive long-term supports and services in settings other than nursing homes face similar COVID-19 risk factors compared to people in nursing homes. Like those in nursing homes, many people with disabilities rely on the close physical proximity of caregivers for their daily needs, which limits their ability to adopt preventative measures, such as social distancing. Today's announcement of the inclusion of a broader group of people with disabilities in Phase 2B addresses the equity concerns for people with disabilities. The individuals included in today's announcements represent some of the poorest and hardest to reach in our disability community. And this works with the efforts of the Equity Task Force to ensure that all Marylanders are encouraged and supported to get vaccinated. Speaking to Marylanders with disabilities, when it's your turn, please go get the shot. At the mass vaccination sites, the Department of Disabilities is working with the Maryland Department of Health to make sure that reasonable accommodations are available to serve your needs. For those who find it challenging to get to the mass vac sites, the department is also working with the Maryland Department of Health, local health departments, and community organizations throughout the state to create pop-up clinics to expand opportunities for individuals with disabilities to get the shot. The vaccines are safe and effective, and they are the key to ending the pandemic. Again, I thank you, Governor Hogan, for ensuring that all Marylanders, including those with disabilities, have critical access to vaccinations.
Good afternoon. Governor Hogan, thank you for your continued leadership and steady hand throughout this crisis. Fellow Marylanders, good afternoon. Like different chapters of a book, at times in this past year, we have felt many emotions, including sadness, frustration, fear, and anger. I have felt those feelings too. Despite these anxieties, we have all stepped up and demonstrated the unity, strength, and courage to persevere. Importantly, more and more, I am now feeling a degree of optimism and hope. This is the direct result of two factors: the confidence I have in Marylanders to continue to protect themselves from this virus and the availability of vaccines. The components of a successful vaccination campaign are, number one, vaccine supply; number two, a coordinated, robust mechanism to administer the vaccine to those who need it; and number three, willingness to receive the vaccine. To date, continued data suggests that the vaccines currently approved for use in the United States are safe and very effective at protecting us from COVID-19. Many reports suggest that more vaccine will be available over the next few weeks. This is welcome news, and the expansion to Phase 2A provides availability for more of us to be vaccinated, including those 60 and older, and now, in 2B, importantly, those with disabilities. As stated by Governor Hogan, our state continues to rapidly expand the mechanisms to vaccinate, including new mass vaccination sites coming online, and now a pilot program for primary care offices. This all of Maryland, public and private approach is exactly what is needed. Additionally, continued emphasis on the work of the Equity Task Force to break down barriers and expand vaccine access to those who are underserved, vulnerable, and those who are hard to reach is critical work. Finally, the last piece of a successful vaccination campaign is the interest from an individual to receive the vaccine. From reviewing ever-growing real-world data, there is no question in my mind of the benefit of the current vaccines. They continue to demonstrate that they are safe and effective. And to add a little levity to this serious discussion, if risk of COVID-19 or the safety data or even the demonstrated protection of these vaccines hasn't convinced you to get a vaccine, as I understand it, and I'm not sure what our cardiologists think of this, but there is also now a Krispy Kreme donut as an incentive if you get vaccinated. We are in a race between the variants and vaccination rates. And I did want to make one comment about variants, particularly B.1.1.7. Please remember that COVID-19 may cause symptoms including fever, muscle aches, cough, but also importantly nausea, vomiting, and diarrhea. Unfortunately, it appears that B.1.1.7, that variant, is spreading even more easily between us and making us sicker which is concerning. Nausea, vomiting, and diarrhea are particularly notable complaints if someone is infected with B.1.1.7 variant, especially children and younger adults. So please keep this in mind if you or your children start to have those concerns. Get tested for COVID-19 and follow up with your doctor. We aren't done fighting this virus yet. This is very evident from what we are seeing with our European partners. We need to continue to maintain our physical and mental health, which means mask wearing, getting tested for COVID-19, seeing your doctor for any care that's needed, and getting vaccinated. The late poet Maya Angelou wrote, "I have heard it said that winter too will pass, that spring is a sign that summer is due at last. See, all we have to do is hang on." This past Sunday was the first day of spring, and Marylanders have held on. Spring has always symbolized renewal and hope, providing us all a sense of optimism. With continued public health vigilance and vaccination, Marylanders should be cautious but optimistic this spring, as we will realize that new normal we are all working so hard to achieve. Governor, thank you.
Thank you, Doctor. With that, we'll take some questions. Nobody?
First one, Governor, the Jockey Club announced today 146 Preakness, allowing the 10,000 in attendance in May. What's your thoughts on that?
Well, we're really pleased to we've worked together with the Jockey Club like we did with the Orioles for many months on a safe reopening plan for them, and we're excited to get people back to see the Preakness this year. I think it's 11,000 folks that they're going to have. Obviously, typically we get far more than 100,000 at the Preakness, so it's going to be distanced and careful, but I think it's going to be wonderful to have some people safely back in person watching the race.
Governor, Secretary of Treasury yesterday gave some numbers that could be coming. He said between 300 and 400,000 doses possibly. Did the White House give you those numbers? And what are we talking about in terms of volume?
Yeah, so they didn't give us exact numbers, but they were pretty confident about a substantial increase based on the kind of total numbers they're talking about for the country and what our percentage typically is based on our population. I mean, we see it's going to be a pretty substantial increase, but we don't have exact numbers. I mean, I think we were at 220-some thousand. We could be at 350,000, but we won't know for a few more days exactly what that allocation is going to be.
Governor, along those lines, how closely is that new vaccination on the way in tied to this announcement today about the new vaccination sites, especially the one that has been called for from Montgomery County officials for weeks now?
Well, we've obviously been in discussions with all of these locations. It takes an awful lot of work, and Chaz here has been leading the team at MEMA, but working together with health partners, with all the agencies in state government, with our county partners to try to be ready and to study where they should be and what it takes to get them open. But you can't open them without the vaccines, and so the timing of this is very closely aligned. A lot of work took place before today's announcement. But before we knew what we were told today by the White House, we couldn't be positive that we don't want to open a mass vac site with no vaccines. So the supply is coming, and we will be as prepared as anybody in the country.
I'm hearing that some D.C. residents are being able to get vaccinated at some of the mass sites, particularly at NFP Stadium. I wanted to find out what is happening, are there cancellations, and anyone is open to be able to be vaccinated there?
Well, so they are federal assets. They don't belong to us by federal law, where we can't make them exclusively for Maryland residents, but it's on a very small number. But we're getting Marylanders vaccinated in D.C. and Virginia as well. So 99% of our vaccines are going to Marylanders, but in certain cases, particularly people who work in Maryland but live in D.C., we have a reciprocal agreement between Maryland, D.C., and Virginia. I think they did 8,000 of our workers who live in Maryland but work in D.C. hospitals early on in the pandemic. So there's cooperation, but the vast majority of our vaccines are going to Marylanders.
Governor,
Well, there's no question. The only reason I hesitate to give you the exact timeframes or numbers is because we're relying on kind of constantly changing information from the federal government. Today was a very hopeful call that next week they're going to start, that the week after that we should hopefully expect to see more, and that they envision this continuing with real big numbers of J&J starting to come online and continual increases with Pfizer and Moderna. So, you know, we'll get them done as fast as they can get them to us, and we're ready to do far more than we have, and they're promising that they're on the way. It's like the cavalry is finally coming to our rescue, and we're going to be prepared.
Does it seem like the end of April you could substantially have Maryland?
That will have, you know, the president's goal was to open up eligibility by May, and he said finish by 4th of July. We'd like to be ahead of that time frame, and I'm hoping that we can get the vast majority of them, as long as we get the supply. With the infrastructure we have in place, which I think we're ready to far outpace most other places, we'd like to get as many as we can done April and May.
Governor Hogan, Maryland was one of the first states to really track the variants.
Yes.
And set up that program. And I know overseas, especially in Germany, there's a concern that the B117 is about to overtake the initial virus, and kind of two pandemics at the same time about to converge. Do you have any data, or perhaps Dr. Chan does, on the percentage of cases right now that are the B117 or different variants?
Well, so we are very concerned about the variants. I've said before that this really, I would describe it as a race between the vaccines and the variants, which is why we're pushing so hard, why the federal government is pushing so hard to get these vaccines. We have to get more people vaccinated before these variants take hold. The B117 variant is becoming much more widespread throughout the country. That's mutating every day. Our biggest concern now is what they call the New York variant, which is a variant that's sort of, I guess, along the lines of the B117, but it's mutated. And that's right now we're seeing big spikes in New York, New Jersey, and coming down from the Northeast. And so we want to still advise people if they're traveling out of state that they should get tested and to be careful and stay vigilant, because not everybody's keeping their masks on the way we are here in Maryland.
Governor, you talked about wanting to get as many people vaccinated as possible, but do you have a floor, a minimum goal that you'd like to see vaccinated by July 1st, July 4th?
Well, I believe that we don't have an exact number. We want to get as many as possible. Our concern, as I mentioned earlier, a month or so ago, we're going to switch from this process at some point soon. We're going to switch from huge demand and no supply to we're going to have plenty of vaccines, and we're going to be out searching for people and trying to convince people to take them, because some of the data tell you nationally that 60% very much want to have a vaccine. About 20% are kind of what you would call like swing voters. They can be persuaded, but they're not really sure if they want it or not. And 20% are absolutely don't want it. So we want to convince all those persuadables and try to get as many people done. But we're going to have the whole 60% that want one is going to have one in short order.
Less than a week, we're going to start vaccinating with underlying condition. What specific underlying conditions are going to qualify in Maryland? I don't think it's been exactly spelled out.
We're following the CDC guidelines, so it's very clear. We didn't make any deviation from that. These are the recommendations of the federal government, and we can get you.
The Mosley federal investigations, your reaction to that?
So I don't know anything about the investigation other than what I read in the media or have heard in the media, and it's very concerning. Obviously, there's a federal investigation going on, and we're getting bits and pieces of it, but it's obviously something that needs to be looked into.
Governor, can you give any more details about these mass vaccination sites and actual locations across the counties? I know that Montgomery County, two examples were given of specific locations. I've heard County Executive Pittman throw out the idea of maybe Stadium. I've heard speculation of Maryland or Coast in Howard County. What are you able to tell us?
Well, I told you everything I'm able to tell you. I told you where the Montgomery County one is, and I told you where the Baltimore County one is, and that we'll be making the announcements on the other four as we finalize those plans.
I want to ask you about Colorado, Governor. As you know, the last 2 weeks, the country's been engulfed now in another spat of mass shootings. Today, the Senate Judiciary Committee is holding a hearing on two pieces of legislation that's already passed the House, but yet the political divide between the Democrats and Republicans you often talk about ways forward, about people coming together. Is there a way forward on gun violence right now in 2021, or are these sides just intractably opposed?
That's a great question. First of all, I was on the White House call with Governor Polis from Colorado, and all of our thoughts and prayers are with the people who lost their lives and their families. This is a critical issue that I'm hoping that we can find some common ground on. It's obviously something that we're miles apart on. It seems like Washington is hopelessly divided and dysfunctional and broken, and they can't find common ground on any issue. But it's certainly something we need to continue to work together on.
Sorry to bounce around on subjects, but back to the variance and the numbers. So we've seen an uptick in recent days, pretty much across the board. Hospitalization substantial today. Is that the variance? Is that what is going on right now?
So maybe I'll let Dr. Chan talk about that one a little bit. We had a call with all of our doctors, and there are, I think, multiple things going on, but we had a slight uptick in hospitalizations, and our case numbers are down. So we're plateauing is what we're kind of seeing in the numbers. We don't have any spikes anywhere. Still well below all the projections and well below our previous highs, but it's concerning. And some of the discussion is that while these variant, we have 2 million people, 2.2 million that have been vaccinated. There's some people who have already had the virus. There are fewer people to get infected, but this more virulent strain seems to be impacting younger folks. We're seeing people being hospitalized now that are in their 40 to 60 range instead of people in their 80s, and we're not having an issue with our nursing homes anymore. It was mentioned earlier about, different, Dr. Marcosi talked about different symptoms that we're seeing. It's a different strain. We had kids at the Naval Academy that were much sicker than last time and having these intestinal issues rather than respiratory issues. So we're keeping an eye on those. We're testing the variants at a greater rate than just about anybody in the country and more than most people in the world. We were already ahead of nearly everyone at 5% of the cases we were testing, doing the sequencing. Now we've doubled that to 10%, but it's still a small percentage of all it takes a long time to do the sequencing. It's much more difficult. It's not just do a swab and tell you the result. So we're staying on top of it every single day. I don't know, Dr. Chan, did you want to add anything on?
Thank you, Governor, and thank you for that question. I would just echo that, we are looking at the changes in the numbers. We're keeping track of that, of course, on a daily basis. And with our partners, we, of course, increased our capacity at both Hopkins and the University of Maryland for sequencing purposes. And so we're really talking about how we can target that capacity to find out some of those answers. So there'll be more to come, but we are seeing, as Dr. Marcosi and Governor Hogan has indicated, the B117, the UK variant, both in the United States and here in Maryland. So that's why the masking order and others are still so critical.